Diabetic neuropathy is painful and is the most chronic complication of diabetes, happening when high blood sugars damage nerves over time. The most common form of diabetic neuropathy is in the feet and legs. We call this peripheral neuropathy. Often it seems to get worse at night. The symptoms include burning pain or numbness, or a reduced ability to feel pain or changes in temperature. Some people get muscle weakness that can affect your balance or coordination. Diabetic neuropathy can contribute to ulcers, infections, and deformities. The autonomic nervous system takes care of things that normally operate automatically, controlling your heart, stomach, lungs, intestines, bladder, eyes, and sex organs. Diabetes and high blood sugars can affect any of these, leading to urinary tract infections, incontinence, constipation, or uncontrolled diarrhea, difficulty swallowing, as well as an increase or decrease in sweating. Autonomic neuropathy can affect the ability to adjust blood pressure and heart rate. That can lead to lightheadedness on standing and can contribute to falls. Vaginal dryness and erectile dysfunction are things no one wants to talk about, but both can be caused by uncontrolled blood sugars. Another type of diabetic neuropathy is radiculoplexus neuropathy, affecting the nerves in the legs, thighs, buttocks, or hips. Symptoms usually happen on one side of the body, and most people improve at least partially over time. The symptoms can include sudden sharp pain in the hip and thigh or buttock, and some people can get weakening of the thigh muscles, making it difficult to rise from a sitting position. Another type of diabetic neuropathy is called mononeuropathy and involves damage to a specific nerve in the face, torso, or leg. It tends to come on suddenly and usually happens in older adults. It usually doesn't cause any long-term problems, but it can be scary while it's happening. The signs and symptoms depend on which nerve is involved and can include difficulty focusing your eyes, aching behind one eye, difficulty focusing or double vision, Bell's palsy or paralysis on one side of your face, pain in your shin or foot, pain in your lower back or pelvis, pain in the front of your thigh, and pain in your chest or abdomen. Often this can be hard to figure out, and bad things have to be checked for and ruled out first. The nerve fibers in our bodies are small and delicate, and high blood sugars damage them over time. Smoking and alcohol abuse can damage nerves and blood vessels and need to be avoided to prevent worsening diabetic neuropathy. Charcot joint usually happens in the foot and is joint deterioration caused by nerve damage. This is a bad complication that can happen to people with poorly controlled diabetes. Diabetic neuropathy can cause a loss of sensation that contributes to this, and keeping blood sugars controlled can prevent this from happening. Diabetes affects all parts and all systems of the body. The reason your healthcare provider is concerned about high blood sugars is to prevent problems that can be difficult to treat once they progress. Having diabetes is a drag and a burden, but it can be controlled with education, medicine, and lifestyle changes. Taking care of your diabetes is worth the effort. You have people who care about you and depend on you. Remember to call an elder. They've been waiting for your call. I'm Dr. Arnie Vainio, and this is Health Matters.